Welcome back. Neurology, upper motor neuron weakness. Upper motor neuron weakness and lower motor neuron weakness you'll hear about a lot in neurology, and it is important concepts to know about. At least have a schematic representation in your head on what UMN is, upper motor neuron, and LMN, lower motor neuron. You'll see those abbreviations are sometimes used, and yes, let's get into it. So let's first think of a schematic representation of the upper motor neuron pathway. The upper motor neuron pathway can also be referred to as the upper motor neuron tract. Just take note of that. So the upper motor neuron tract is the same as the upper motor neuron pathway. And we'll just be taking a quick look at or a quick listen to what the upper motor neuron pathway contains. So you start at your motor cortex. This is the first step in an upper motor neuron tract. You'll then, from your motor cortex, go to your corona radiata, following to your capsula interna, following to your midbrain, then your pons medulla. Remember those three orders, just in general as well. It's first the midbrain, then the pons, and then the medulla. After the medulla, you're going to get the spinal cord, you're going to get your bulbar tracts then, branching off from that, and then you'll get your lower motor neuron tract. So now, those were the steps all the way to the lower motor neuron tract. After your lower motor neuron tract, you can either go to the corticospinal tract, which will go to the spinal cord, or you can go to the corticobulbar, which will go to the brainstem. Remember, the upper motor neuron tract refers basically actually to the corticospinal tract. Remember, corticospinal means it's going from the cortex in your brain to the spinal. It's a descending tract. So there are many conditions that affect this tract at different anatomical levels. So different neurological conditions can affect the corticospinal tract at different levels. That's why it's so important to know about this tract and know it goes from your motor cortex through your corona radiata to your capsula interna to your midbrain, to your pons, medulla, spinal cord, bulbar tract, and then to your lower motor neuron tract. The lower motor neuron tract will present a different kind of picture usually, so just take note of that. Everything isn't the same as the upper motor neuron. So you get your UMN, which is your upper motor neuron weakness syndrome, and that's very important to know about because, as we've just seen, the tract can be affected in different anatomical levels, and we've just looked at all the anatomical levels. Those were like, for example, the pons, the capsula interna, the motor cortex. So therefore, it can be affected at those anatomical levels. For example, the medulla oblongata, at the level of medulla oblongata, it can be affected. Or it can be affected at the level of the internal capsule. Or it can be affected at the level of the midbrain, or it can be affected at the level of the pons. So just take note of that. They frequently result in a specific clinical picture. That's why you would learn about them, because you can actually diagnose such a problem, because you can see what clinical picture or syndrome is presented by knowing what upper motor neuron weakness usually presents with. And this includes things such as muscle weakness, because remember this tract is impaired now. Maybe increased deep tendon reflexes is also a thing for upper motor neuron weakness. Also your patellar clonus. You've got basically no atrophy. Atrophy is usually to do with your lower motor neuron weakness, so just take note of that. It's very important to know there's very little or basically no atrophy that is associated with the upper motor neuron weakness. That is for lower motor neurons. So you can also get a flexor withdrawal or reflex with upper motor neuron weakness syndrome. and even hemi, quadriplegic, and para distribution of weakness. Remember, weakness is represented both in upper motor neurons and lower motor neurons. Weakness is not the same as atrophy. Take note, atrophy is lower motor neurons. There is little or no atrophy. I'll repeat that. There is little or no atrophy present in upper motor neurons weakness syndrome. But, however, there is weakness seen in both of them. So there's no atrophy seen in the upper motor neuron weakness syndrome, but there is weakness seen in upper motor and lower motor. Also, the upper motor neuron weakness syndrome can present with an extensor plantar response. So that's actually also called the Babinski response. Most people know it as the Babinski response, but it can also be referred to as the extensor plantar response. And also you will get absent or even decreased abdominal reflexes in an upper motor neuron picture. So just take note of that. Those are some important tips. Those are the most common important tips. And know the differences between upper motor neuron weakness and lower motor neuron weakness. They're often asked to differentiate between the upper motor neuron and the lower motor neuron picture and know which one presents with weakness, which is both, which one presents with atrophy, which is your lower motor neurons, and even the Babinski signs and stuff like that. Your extensor plantar responses, your Babinski response, which is important for the upper motor neuron, and that is really important to know.